Hi, this is Dr. Perry Wolk-Weiss, your Somerset County, New Jersey chiropractor here at the Get Well Center in beautiful downtown Bound Brook, New Jersey. And we're here today with Katie because what I want to do today is show you an exam on a young athlete. Katie runs track, she plays basketball, and I want to show you the type of exam we do here at the office when we're evaluating patients. Now, athletes will certainly have problems because they can fall down and get injured when they're playing a particular sport. But they also come to me to stay in peak performance, stay in the top of their game. And especially with young kids playing a lot of sports, and especially when they're growing, it's really important to make sure structurally that their body is sound. Because if their body goes out of balance, not only are they going to have aches or pains, knee problems, lower back problems, but as they go into adulthood, these problems can come back to haunt them. So it's really important when we're working with kids to be especially careful in making sure that their body is really in a structurally good place. So we're going to take a look at Katie's posture first. We start with a posture check all the time. Look straight ahead for me here. We first check the shoulders, and then we check the hips. And Katie's shoulders are pretty good. Her left shoulder just slightly higher than her right side, just off by a little bit. And the reason we want to check the shoulders, because especially at this age when they're growing, and especially in young girls, they could potentially have scoliosis, which is a curvature in the spine, and we want to make sure that's not going on. And if we see an imbalance, something like this, that could put a lot of structural stress in their spine, so it's really important to make sure that that's taken care of right off the bat, and you catch that early. And even though a lot of schools do scoliosis screenings, they often miss some of the subtleties that I pick up having been doing this for so long and seeing so many spines. So Katie's looking pretty good here. Then we also have the patient turn to the side. Turn your whole body for me. Whole body, feet, too. That's good. Look straight ahead for me. And we look at side posture. And nowadays with a lot of kids who spend a lot of time on their tablets and laptops and sitting in poor positioning, you see a lot of forward head posture. Katie's got pretty good posture here. Her head is balanced over her shoulder. So if you draw a line through her ear, and you can do this with your kids at home, if you draw a line through her ear, it should split her shoulder, and hers is looking pretty good. Sometimes you see this forward head posture. I want you to bring your chin forward for me, like this, where her head is too far forward, and if you draw a line through the ear, it falls in front of the shoulder. That puts a lot of stress in the upper back area, in the neck and shoulder area here, and that can create a really big cause for a lot of headaches. So if your kid has headaches, it may have nothing to do with anything else other than really poor posture, and that's something you should take a look at. So now that we looked at her posture and we know that her posture is pretty good, and we can sometimes go through ranges of motion, I'm going to get her to lie down on her back on the table. That's good. And we're going to raise this up. That's good. Slide down a little bit. That's great. Good. So once we got that posture exam out of the way, what I'm going to go through is test some of the muscles related to structurally stability, and particularly the lower back area. So with Katie, I'm going to ask her to hold her leg out here. I'm going to push in. You're going to push out nice and strong. Push out. Great. She's nice and solid. And this one, you're going to push out. Oops. Nice and strong. Push. Good. She's really solid there too. Now, when we're doing muscle testing is really important if you do it properly and giving you a lot of good information about what's going on with the body. And when I'm testing a muscle, it's not about really how strong someone is. I've tested 90-year-old women, and they can do really fine on muscle testing. It's about matching the patient's muscle resistance and making sure that you just give a little bit extra, and they should be able to hold it. If they can't hold it, there's something going on structurally. We're going to have her bring her leg up. This is called the psoas muscle. It's an important muscle stabilizing the lower back area. You're going to push your leg towards me. That's good. She's solid. She's got good, strong muscles there. Turn this one out. I'm going to push this way. You push straight up. Good. And that one's good too. Now, if this muscle happened to be weak and she was having knee problems, that could be the big cause of the knee problems. I see a lot of people come in with knee pain, and they think it's because they injured their knee. And very often it's not really their knee that they injured. It's actually something else going on structurally that's changing their gait. And because it's changed their gait, it's starting to stress the joints. It could be a knee, it could be an ankle joint. In her case, she's got really good, strong muscles there, so she's doing great with that. I'm going to get you to turn on your stomach for me. That's good. Bring your arms down like that. That's good. Slide over this way. Good. Well, I like to check leg length in every patient that I see. When your leg length is off, it doesn't mean she actually has one leg shorter than the other. What it means is that the pelvis is often out of alignment. And when that happens, it's like walking around with one shoe on and one shoe off. And especially in someone who's a long distance runner, that can be a problem. And she does have a difference in her leg length. And we can take a look. If you look down here, you can see this right leg is a little shorter than this side. So it means that her pelvis is out of alignment on the right side. So that means that this hip bone is rotated backwards. This hip bone is rotated forward. And that imbalance puts her gait at risk. And that can develop knee problems. Now, sometimes we'll see some of those muscles on the front of the body weaken because of the hips out of alignment. But in this situation, we didn't see it. So I'm going to test Katie's hamstrings and see how those are. I'm going to ask you to push your heel to your rear end. Push. She's pretty solid there. I'm going to ask her to push your heel to your rear end. And she's pretty good there too. So her pelvis is out of alignment, but it's not impacting any of the muscles right now that we can see. But what will happen over time is that one of those muscles can start to weaken. It can, as I mentioned earlier, set her up for knee problems. But like I said too, when the pelvis is out of alignment, when there's that leg length difference, it's like she's walking around with one shoe on and one shoe off. And to fix that is a pretty easy thing that we do. Lift up for me here. That's good. We're going to slide this board underneath, rest down. And we use these wedges, put these wedges underneath like this. Good. Rest down. And this one here, rest down. That's good. And now we go back and recheck, and we can see her leg length is now nice and equal, which is great. And we put a little pressure on her hip joints to put them back in the right position. Doesn't hurt. Good. And we take that out. That's good. And rest down. Okay, we can go back and take a look, and now we see they're staying right exactly where they need to be. Now, her pelvis will stay in alignment, obviously, until she does something else that can throw it out of position. Most often it can stay for a long period of time. Sometimes it'll stay for months, weeks on end. Other patients, they go out a lot. I had a guy who was a painter. He's up and down ladders a lot, so he's constantly throwing it out of alignment. A lot depends on what you do through the day. I'm going to take a look and check her upper back here. She's got some vertebrae out of alignment in the upper back. And her neck is off a little bit too. So what I'm also going to show you is how we gently adjust, and I'm really about gentle adjustments. You know, a lot of people get fearful of chiropractors and what an adjustment's all about, and I'm all about gentle adjustments, moving the vertebrae so we can take the pressure off the nerve and getting it functioning properly so your brain can talk with the rest of the body and have the body work at its best. But I'm also about making sure the patient stays comfortable, and we really have to be tuned in to what the patient's body needs and what that patient's willing to tolerate. I'm not going to adjust a 6 or 7-year-old the same way I'm going to adjust a 40 or 50-year-old. And you get a big guy in here, I'm going to adjust them differently. I'm going to adjust someone like Katie. So the skills I have is really about tuning into the patient and what the patient needs and adjusting for what they're comfortable with. Let your arms relax down. I'm going to have her take a deep breath in. Let it all the way out. Good. Now, I know some people think that's pretty scary. If you do it right and if you do it correctly and you're paying attention to your patient, which we do here all the time, it can be really comfortable for the patient, and patients feel a lot better after that's done. Let me get you to turn on your back for me. That's good. I'm going to raise her up a little bit here. Good. Next thing I'm going to check is her neck. Since all the messages from your brain have to come through your neck first to the rest of your body, it's really important to make sure. Now, Katie, you feel a little tenderness right here? Yeah, Katie's neck is out of alignment up here, and that's the first cervical vertebrae. It's the first vertebrae right underneath your skull. And if people have headaches, that's a common misalignment that can trigger headaches and sinus problems. So that's a big area that we want to take a look at. Also, as I mentioned earlier, every message from the brain has to come through the neck first. So from a chiropractic standpoint, we want to make sure that's functioning properly, because I like Katie's brain talking to the rest of her body. So neck adjustments are really gentle. There is no of this watching the movies, ripping the head. It's really gentle, and we work real carefully with patients' necks to make sure that they're comfortable. So it's going to turn nice and easy. There we go. Good. How was that? Was that pretty gentle?
Yeah.
Yeah, it's pretty easy. So let me have you sit up. One of the other things we like to do with patients, especially people who are still in school and they're sitting at desks, and even if adults are working at their desks all day long, is adjusting this upper back area between the shoulder blades. People tend to get a lot of stress up there. So we're going to use this board. We're going to put your hand here. You're going to put your hand here. Come on back nice and easy. Good. All right. That was pretty good, right?
Yeah.
Yeah. All right. So after we do an adjustment, if there's any muscle weaknesses we found initially, I would go back and recheck those and make sure those are functioning properly. Katie's pretty good. Her leg length is good now. Her neck is properly functioning right now, and her upper back is well adjusted. So Katie's good, and she's going to be running track this weekend?
Yes.
Yeah, so now I know she's definitely going to run a lot faster than she did before. I guarantee it. So this is an exam that we typically do on adults as well as young athletes like Katie, and we're really gentle about how we adjust the spine. I never adjust the spine unless a patient gives me permission first, and they got to be comfortable with it, so I explain it to them initially so they understand everything that's going on. And Katie, you did fine, right?
Yep.
All right, great. So this is Dr. Perry Wolk-Weiss here at the Get Well Center located in Bound Brook, New Jersey, your Somerset County, New Jersey chiropractor. You know, we provide short-term care for your neck and back pain.